This video is all about hip osteoarthritis. I feel it's important to begin this section by pointing out some big osteoarthritis myths that simply aren't true. Number one, the degree of osteoarthritis on a scan predicts how bad your pain is. Number two, having more pain means you're causing more damage. Number three, exercise is dangerous. And number four, rest is helpful. They are myths surrounding hip OA that need to die. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. Please share this video with anyone suffering with osteoarthritis of the hip. The traditional belief is that OA is a wear and tear disease, has been debunked by evidence, and we now know it's a whole joint disease with many risk factors, including a lack of physical activity as one of them. So what are the risk factors for developing hip osteoarthritis? People who have hip dysplasia are 5 times more likely to develop osteoarthritis and need major surgery by the age 35 compared to 65 without hip dysplasia being a factor. Number two, another cause of hip OA is a calm bump on the hip joint. Removing these bumps is far too commonplace in healthcare. When you scan hips and you see a calm bump, which just is a little excess piece of bony growth, there's strong evidence not to remove it. Even in the surgical literature, it's clear you don't take bumps off people who don't have pain. Number three, underloading and being too sedentary is a big risk factor for developing osteoarthritis. Activity-related loading is integral to joint health. Underloading leads to poor joint health, or people have hips where the consequences of being sedentary are greater than others. Either way, disuse is a problem. Astronauts who come back from a period of time in space develop joint issues believed to be due to the fact that they haven't use that joint. Number four, at the other end of the spectrum, there's an issue with overloaders of the hip joint. This is often due to sport or occupation. So people with physically demanding work and high impact elite sports, people often have increased risk of developing OA in their hip. Number five, hip issues and disability scores are higher in women than men throughout their lifespan. Some of the reasons for this are believed to be the fact that women give up sport earlier, often in their teenage years. The traditional family structure means that women often don't continue with physical exercise and they put their family first for a significant period of time. Hormonal factors may also be involved. Up to this point, most of the research has been done in men. A cluster of factors need to be used in diagnosing hip osteoarthritis. Over the age of 35, underloading or overloading of the joint, family history of osteoarthritis, hip pain as a child, pain at rest, nighttime pain, a clicking, locking, catching in the hip joint, morning stiffness, reduced range of motion, which you might notice in putting on your socks or getting in and out of the car, walking with a limp, having pain in the groin or the front of the hip. Just because you have one or two of these does not mean that you have hip osteoarthritis, and to get clarity on that, you need to be tested in clinic. The treatment and management of hip osteoarthritis. Everybody should be having a combined early intervention of education, exercise and weight loss where appropriate as the first line of treatment. Some people may then have to go to a second line of treatment of drugs, passive treatments like manual therapy. Some people then do need to go to surgery. But even these people should be engaging in the first line of treatment. So if you look at the picture below, most people should be getting the green part, with fewer and fewer people getting the orange and red parts. But what should be happening isn't happening. When it comes to hip osteoarthritis, GPs refer 3% of people for education, exercise and weight control, while over 40% get medications and surgery. About a quarter of people are referred straight for imaging, which, as I've mentioned in previous videos, brings about its own problems. While most people should be exercising for osteoarthritis, most people aren't doing that, and most people never even actually try it. Exercise with education can reduce total hip replacement by 44% in patients. This is even in end-stage OA, and the benefits even last years. So you have to be getting on to education and exercise and weight control. In regard to supplements for osteoarthritis, common ones used are glucosamine, chondroitin and turmeric. They're certainly safe to take them if you want, and you might get some reduction in pain in the short term, 1 to 3 months, but the effects disappear after that. The benefits of a strength training program are far greater than just the strength aspect. There are social and psychological benefits, and improvements in self-efficacy and confidence should be important targets, as some pain will still exist. Pain always needs to be bearable and not flare up or be worse the next day. Here's a sample home and beginner program which you could do 2 sets of it 3 days a week. You've got hip band exercises, knee extension exercises, hamstring foam roller exercises there, sit to stand, and you can also include going for regular walks as part of this approach. Here is an advanced program. This can be done in the gym, doing 3 sets of it, of maybe 6 to 8 repetitions. If you are in the gym, you can use the home program by 1 round as your warm up for it. So exercises like sitting on the bike, side plank, side step up, reverse and forward lunges can be used, and you can modify the range here or hold on to a stick to help with balance. Deadlift and actually hip thrust is also a really good option here. So there's lots of things you can do. You can definitely go and exercise and strength train and feel all the benefits for that. The take-home message from this video should be that the diagnosis of hip osteoarthritis isn't a license to stop, rest, protect and avoid activity. It actually should put more of an onus on you to do more to help yourself. If you have any questions regarding your diagnosis of hip osteoarthritis, please feel free to comment below and we'll get back to you. Thanks.